my understanding, we're the only industrialized nation, especially of this size, that doesn't have a healthcare system.
You're asking me to reach in my wallet and pay for somebody else's health care.
We do need the government for certain things. If we need them to help finance and they are able to finance, why not? I think the people should be the #1 priority.
This edition of Louisiana Public Square is a By the People special, assessing the nation's health care.
This program was made possible by the William and Flora Hewlett Foundation, with additional support from the Rockefeller Brothers Fund, the Corporation for Public Broadcasting, and by contributions to your PBS station from viewers like you. Thank you.
Good evening and welcome to another Public Square. I'm Beth Courtney. This program is part of a national initiative called By the People.
I'm Craig Freeman. Tonight on Public Square, we look at healthcare issues affecting the nation and the state, specifically spiraling healthcare costs and different approaches to paying for America's staggering medical bills.
Tonight's discussion segments were taped as part of a Deliberation Day event called By the People. Local citizens selected by a scientific random sample gathered in 15 communities, including Baton Rouge and Hammond, to deliberate about the health care crisis in the United States.
The discussion was meant to accomplish on a national level what Louisiana Public Square tries to do every month, and that is to highlight and broaden public understanding of issues confronting us all.
Before beginning their deliberations, participants viewed a brief healthcare background video prepared by McNeil Lear Productions. This overview points out some of the major problems and proposed fixes currently on the table.
Big breath.
As the cost of healthcare continues to rise and millions of citizens are left uninsured or underinsured, a large majority of Americans think our healthcare system needs fundamental changes. In addition, the cost of employer contributions to health care has skyrocketed, impacting global competitiveness. General Motors, for example, must add $1,500 to the cost of a car to cover health care for current and retired employees and dependents. Small businesses as well struggle to cover the expense. By 2014, total health care costs to individuals, business, and government could total $3.6 trillion.
He may have something in his lungs, although he has not had any kind of fever.
Some say patients should shoulder more of the health insurance expenses through higher deductibles and co-pays. In this way, patients would become more efficient healthcare consumers, getting only necessary treatments and buying lower-cost generic drugs. But critics warn that people, especially the poor, would delay or skip care until it became an emergency with higher costs.
This is his first shot, correct?
Others suggest managed care, which lowers costs by promoting prevention.
Then over here we have meats, muscle, protein.
Limiting choices of doctors and drugs, and reducing inefficiencies. Those opposed worry that both doctors and patients will lose decision-making ability. And what role should the government play? Medicare, with a rapidly rising aging population, and Medicaid face serious long-term financial challenges. Some say we should restrict government resources to force providers to become more efficient. Yet others think the best way to reduce expenses is through government involvement, either in the form of price controls or through a national insurance system. On any given day, 45 million Americans are without health insurance. How can the U.S. insure all its citizens? Some options being considered: a single-payer system, employer-mandated coverage, individual-mandated coverage, or a shared responsibility. Those who favor a governmental approach point to a single-payer system, such as the one in Canada. A government-run organization would collect all healthcare fees from individuals and pay out all healthcare costs. Supporters say a single-payer system would guarantee total coverage, relieve the burden on businesses, and save administrative expenses. Critics think this system would give the government too much control and that the quality of care would suffer. Another approach, employer-mandated coverage, where all workplaces would help cover their employees' health insurance costs.
Who do you drive for?
Some say this approach would leave out the unemployed and the self-employed, and that American businesses already overburdened would lose competitive edge in world markets. Other options: individual mandated coverage, which would force people to find minimal insurance, perhaps funded with a tax credit, or a sharing of responsibility among government, business, and individuals. Now, some questions. What healthcare challenge is most important to you? How can the public more effectively be a part of the conversation about these challenges? And what should be the role of citizens, business, and government in paying for health care?
Under the Deliberation Day format, our citizen participants gathered in small groups to discuss the issues and to generate questions for our panel of experts.
As with every Public Square program, we polled our participants ahead of time on their attitudes. 37% identified themselves as Republicans, another 26% as Democrats, 18% as independent, and 15% other. When presented with a list of health care problems, 46% checked cost of health insurance, while 40% were most concerned with the number of Americans without any health insurance, and the remaining 14% of our participants listed the cost of prescription drugs as their biggest worry. 35% thought their elected representatives in Washington shared their health care priorities to one degree or another. 42% felt their representatives in Washington did not share their priorities. Slightly fewer, 28%, felt their priorities meshed with those of state representatives. 43% thought their state representatives did not share their health care priorities. Over half said they'd be willing to pay more for their health insurance if this meant many more Americans would have health coverage. 60% felt that increasing government control of health care would be effective in controlling cost, but only 1 in 5 thought that limiting government funds would be an effective cost reduction measure. Finally, of those feeling strongly on the issue of what the first priority of government should be regarding health care, the highest number, 39%, felt the top priority should be to make the whole country prosper. The cost of health care was a dominant theme in many of the small groups.
The first thing to focus on is solving that rising cost of health care and why it's been rising so fast, uncontrollably. Now that's the big issue. If you go back 20 years, you didn't hear all of this. And employees were covered by businesses. They did not gripe. People were paying part of that as part of their salary. But the cost has skyrocketed. So the question becomes, why? Of course, it's big business, drug companies, and patents. And they can extend the patent just by tweaking something. And so they maintain price control. It's like a monopoly on prices. So we need to start solving the problem of cost.
I strongly disagree with that. We have the technology to keep a body alive. If you keep a body alive for 30 years, that's millions of dollars. A lot of times people go in, they say, do what you got to do. You know, in the old days, you used to get sick, you go through a period of time, and you might pass away. Today's world, they can give you some drugs, pretty miraculous, or they can keep a inanimate body alive for a long time. That costs money.
So you're saying cost should be not controlled?
I don't think you should be beating up on the drug companies. It's a company.
If the rich are the only ones can afford a drug, you think that's fair?
But the drugs are priced so high because the people paying for the majority of the drugs, which are governments, are immune to any of the effects of that price. If you're a government bureaucracy and you're buying huge volumes of drugs like Medicare, Medicaid, you're immune to the price. You don't care what the price is.
The price go down with them. Now, come on, you're on the government kick.
The government raises the copay a little bit on the drugs. Drug companies boost the prices because they can. It doesn't matter. If the government didn't pay for it, they'd be forced to lower the prices because people couldn't afford it to begin with. You only charge what the market can afford. The government can afford a lot.
Less than the private citizen for its medicine.
Right, because it buys more.
I have a concern when we begin to blame everything on the drug companies. The drug companies are profit-driven. That is the way our country works. And in a capitalist society, it is the profit motive that drives a company. So if a company can develop a new drug, it may cost them hundreds of millions of dollars. Now, when that drug is developed, the actual production cost of that little pill may be $1. But they have hundreds of millions of dollars of expenses behind them that they have to recover sometime. And when we start talking about the high cost, we talk about 20 years ago it didn't cost much. Well, 20 years ago, did we have MRIs and CAT scans and pinpoint radiation to treat cancer with, the kinds of heart surgeries that are done now? I think about doctors and clinics that go out and spend $1 million, $2 million on a piece of machinery that our wonderful technology is moving so rapidly, and 6 months from now, that machine is lagging cutting-edge technology. Somebody still has to pay for that machine. So there is still a cost to be incurred, and whether we like it or not, doctors are businessmen too.
We need the equipment, we need the treatments, we need all of that. But if you cannot afford that and you need that, what do you do? Do you allow the sick to heal the sick? Do you allow someone to just continue on that cannot afford it?
Melvin, earlier you talked about health care costs being the #1 priority. What are the other priorities?
The 45 million Americans who are uninsured. And this includes some of the people around the table, those who are self-employed, those who are employed part-time, such as myself, and those who are the working poor. The working poor. Those are 3 groups, and I'm sure that there are others.
Should the government pay for health care? Should employers pay for health care? Should individuals have to pay for health care? What do you think? Alfreda, you look like you're ready.
I guess so. I think government should have a big hand in helping with the health care, because there are so many people that are not employed. There are so many people that are employed, but not the type of employment that can afford health care. So with the great deal of people that we have today without the health care, I think that some form of help is needed urgently.
Do you think a system like Canada's, with the single payer system where the government pays everything?
Maybe that's a good system for Canada, whereas I think it may be good for some here, but others it may not benefit, because even a copay, many people would have problem paying. So it may be another system that we have to come up with in order to help the people to be able to afford the health care and to use it.
Other opinions? Anne?
I think the worst thing in the world would be to have a government control system. I don't think the government is capable of doing anything efficiently, cost effectively. I think we can use Katrina and the aftermath here as a prime example that our government is bloated, overloaded, and unrealistic in their dealings with financial matters.
So you wouldn't trust the government with your healthcare dollars?
No.
The government has our healthcare dollars now, and they're not doing a very good job.
That's right.
It should be the person's responsibility, and due to the seriousness of the government intervention in the system now, it drives up the cost. They announce a drug plan, and all of a sudden drug prices go up 10% because now there's more money in the system to pay for the drugs. So you're going to be a good capitalist, take advantage of the system. If government's going to pay for health care, it should be for those people that truly need it. Otherwise, the government should get out of it. And what I really see one of the biggest problems, local, state, and federal, is that they make so many rules and regulations driving up the cost. There's so many things that insurance companies have to pay for, they have to make up that money somehow.
Well, I don't know, there's a lot of blame on the government, and I don't agree with all of it. The government, as we have it here, farms our stuff to business. Who cheats? Look at the oil companies. $10 billion in profits. They don't have any control over it. Price of oil goes up. Prices at the pump go up. They don't experience the expenses. And if it's based on a reasonable profit, I mean, come on. Government is really not the boogeyman in this thing. It's how it's implemented. And you always get fraud in companies implementing government programs. Now just look at how many people have been indicted for fraud by implementing government programs. So it's the people who have to do the thing that we look at. Now in this case, I believe it should be shared between the government, business, and the individual. Each person has a responsibility to pay for their health care.
But the government is not mandated by any chartering document for our governments and state and federal to force people to pay for other people's health care, which is what you're saying.
No, I'm not
You're
saying
asking me to reach in my wallet and pay for somebody else's health care. There's nothing in any government document that says that's a lawful right for any other citizen to have due. If you get on people about making money, that's what they're supposed to do. When you look at governments, the government mandates what insurance companies must cover. If you got to cover Viagra for 80-year-old men, you got to cover sex change operations, heart valve replacement for a convicted murderer, why aren't you taking that money, using it to take care of Ruth over here?
And I don't think anyone is asking anyone to pay. It's just that a lot of people are in a position where they would love to pay for their own insurance, but they cannot. They don't have, for whatever reason, the income, if it's the job that's not allowing them to have the income to pay for their insurance, but they need help. You have a lot of people that are desiring to be able to take care of themselves fully without the government. And two, yes, the government has failed in a lot of areas. We all know that and probably will continue to, just like we do, but we do need the government for certain things. If we need them to help finance and they are able to finance, why not? I think the people should be the number one priority. And I think what the government does should be for the people and by the people. If the people here are not, if they have not allocated or found a way to protect the people with health insurance or even preventive health measures, I think that can and should be done. Now, whether it take a group of people like us to get there and help them, give them ideals, then perhaps we can do that. But I do think that if they can go and support other countries, first of all, the people here should be supported. Nothing wrong with supporting other countries, but I think first, home should be taken care of.
Bernice, you look like you.
Yes, I would like to see a win-win situation in restructuring health care where the entities that are involved, government, business, and individuals, could come to the table and establish a system in which these three entities would commit to the values of a universal access for all people, fairness, and also accountability and access for everyone in the population.
Susan, I saw you nodding your head. It looked like you were.
I was very much in agreement with Alfredo. Kevin, you were talking about how, you don't want to reach into your wallet and pay for it. Well, some of us can't afford to reach into our wallets and pay for it. I pay for my health insurance. I just got it. I am 28 years old, and I, for the first time in my life, have health insurance, only because I have a job and I'm management. Now, the people down below me, they can't get the health insurance because it's not offered in our job.
My personal opinion is it should be noblesse oblige by the government, the noble obligation. We need to protect the weakest elements of our society. If you can't afford the health care for your kids as it is, we need to make sure those kids get their eyes checked, their teeth cleaned. We need to make sure they get their immunizations. If you fall and break your leg and you can't pay for it, we need to make sure that you get the care to get your leg fixed. You can get back out there and do whatever you need to do. We need to make sure Ruth is not going to die on the street like a dog. That's no problem. I have no problem with that. I have a real problem when the government begins mandating so many things that you cannot afford it, because that's where a lot of this comes from. You forget the healthcare system pays for the illegal immigrants from California and Mexico and places like that. You forget it pays for people who choose to drink, who choose to smoke, who choose to do the drugs, who choose to do a lot of things. I can buy discrete units of insurance for my house. I give this example frequently. I can buy fire, I can buy storm, I can buy hail, I can buy all these discrete units of insurance for my house. Cost me $300. I have to buy a homeowner's policy, however, because the state government and the federal government mandates that the type of mortgage I have, I must have a homeowner's policy. I have less coverage under my homeowner's policy, and my homeowner's policy cost me $1,000. My discrete individual units of insurance cost me $300. So I pay $700 because the government says I must.
The government does not mandate the insurance policy. The mortgage company says what kind of policy you have to have in order to get the mortgage. You're blaming the government for everything. That's wrong.
Do you think that we talk about the government, we talk about individuals, we don't talk about businesses. Do you think that businesses should have to pay for every employee's health care?
Well, my business pays half of mine, and if they didn't, I wouldn't have it.
John, what do you think?
Excuse me. Have you realized if you get business to start paying for more health insurance, it'll make a rise for whatever product or whatever they're producing. As far as the government, like I agree with some of the things he was saying, but I agree with most of what you're saying also. The government is not blamed for everything, but the government, when you mandated stuff, you bringing in more excess stuff that don't need to be used. Like you said, for a person who's smoking, it's their choice if they want to smoke or not. But if they can't afford to develop cancer, who has to pay for it? You just can't have them die on the street like a dog because they got cancer. It was their choice. You have to have some kind of compassion for the people. But it should be a stipulation where people, we are responsible for our own selves. And a person like who's low income or very low income, they should have some kind of health care, especially for children, elderly, and people who are disabled who can't go out there and take care of themselves. I think this should be the number one issue, number one priority to have health care that should be provided by the government. And probably some kind of subsidies from big corporations should put a pool of money into this to help supplement money from the government. Shouldn't have to pay for everything.
I agree with Kevin and the points he was making about, some of the things that are covered by insurance. It's a big joke, even with the insured. My daughter goes to a very good school, whereas most of the people, moms don't work and they wear $100 outfits to school. My daughter's not one of those. But it's a joke about what health insurance covers because they talk about it. And I think that when you have people that are in charge of repairing a system that needs so much help, and it's not even a personal concern to them because their health insurance is covered. They're covered for the rest of life, even when they're not in office anymore. I think that's a fundamental issue because what true concern, if their child has Down syndrome or if their wife has breast cancer, they're not even looking at facing this after retirement because it's not their concern. So another thing is that if at the end, when you run out of resources and you're an older person and you go to Medicaid and you have to destitute yourself because you can't qualify for Medicaid until you have no more personal assets, it's all eventually coming to the government anyway. So perhaps, a lot of people are saying, well, no, the government can't control all of it and they won't do a good job if they do. But they're ultimately getting stuck with the most expensive, most emergency and care.
Rosemary, what do you think?
I think, American citizens and companies, the government, I think everybody should be involved and do their share.
It's my understanding we're the only industrialized nation, especially of this size, that doesn't have a healthcare system. And in Canada, there is no copay for most services. You may have to wait a little while, but I think that if you shift the financial responsibility, then you probably get a little bit more results because these people do want to be reelected. And this is something that's very important to most Americans. My family brings in more than a lot of, we're probably lower middle class. We don't have insurance. My husband's self-employed, and I just got a job, we drive a decent car, we rent a nice-sized home, but still, $300 or $600, which is what it cost with my last employer, $600 a month for my family. Well, $7,200 if we're kind of a decently healthy family. You know what we do? We exercise and we eat right because that's not, it's not a realistic expense for us. So, we're kind of doing our own workaround, but I think if you shift responsibility that you might see more results that are favorable to everyone.
Bernice, I saw you nodding your head.
The government is already playing a major role in national health care through Medicaid and Medicare. And I think they're doing a wonderful job. And so with the national health care system, or our considering one or whatever, I believe it's worth revisiting. I remember that was an issue when President Clinton was president. I believe he brought it before the Congress, and obviously it wasn't accepted. But it may be an issue that may need revisiting, and with more input from the public and businesses or whatever, I think it would be well worth the effort to see what would happen.
In Canada, they have a whole different outlook. You know, they have a whole different system. People don't worry about dying without a drug that they can't afford because they know if they really need it, they can probably go get it. But the difference in the relationship between the doctor and the patient, even though you may see that doctor once a year or once every 2 years if you're a healthy person, they talk to you. They talk to you about the whole picture and the process, like, okay, well, your cholesterol's getting a little high, you need to do this and that. And I've lived in a few different states here, and I rarely get an extra minute to collect my thoughts with that doctor. And it's never the whole me they're treating. They're looking at this one, you know, inflamed area. You know, your ears are messed up or your knee is twisted, and you don't get that kind of whole approach. And so I think that is something different for how we as American patients look at our American doctors.
I see that when I go to my clinic here, which is very well known, and those doctors are required to see a certain number of patients a day. So when you go in, rather than you being asked a lot of questions and them diagnosing, they say, what is wrong? My sinuses are infected. Therefore, I get a prescription for infected sinuses. But if, you know, my right ear is hanging off of my head, unless I bring it up, I don't feel like it gets any attention. So I think that we have some real inherent problems in the system mandated by the cost. I don't know what the solution to that is, but I do believe that we've taken diagnosis out of the hands of a lot of doctors. We've also taken the area of prescriptions out. Doctor will not prescribe the drug of choice for you because your health plan doesn't cover that particular drug. Acid reflux is covered by a drug called Nexium. A lot of policies don't even cover Nexium. Acid reflux is very, very common. I have some other questions about how we go about handling insurance, and depression is a society-wide problem now. It is a problem that is recognized, treated with drugs. Once you are diagnosed with depression, if you leave the job you're in and lose the insurance that you have, no one ever will insure you again. So I think that's a serious problem. And I don't know the answer to that.
Can I do my government thing here one more time? I know you like your Canadian system, but there's a lot of court cases in Europe and especially Canada now that says the way the system is run is considered to be inhumane to the people in the system, because you might have to wait 5 months to get a simple operation done, and thereby your problem becomes much more severe and chronic. And of course, Canada doesn't worry too much because they skip across the border to the U.S. to get whatever treatment drugs they need that the Canadian system can't fund. So that's all right.
Because you did mention a story about how it takes sometimes 5 months in Canada and you have to wait and wait and wait. And my in-laws are in their 70s, and yes, sometimes they have to wait, but this wait is like 2 weeks for a doctor appointment instead of maybe the same week or 3 weeks. It's blown out of proportion for the people that want to put that system down, the people in this country that want to put that system down. It works a lot better than people in this country know.
What are your biggest concerns, Susan? I mean, we talked about insurance and we talked about preventative care. Are there any other big health care concerns that you have?
I just really think that if, like, you know, we're worried about our children, we're worried about our elderly, we really are. when I turned 18, my insurance stopped. And in this past 10 years since then, I've had some health issues. I just was diagnosed with some fairly serious things. Had all of that been caught a little earlier, wouldn't have been such a big deal. Snip, snap, no big deal. But I didn't have health insurance to go and get these things. A checkup every year would be a great thing. You can catch so much in just a checkup. Spend 30 minutes with a doctor who can really look at you and tell you what's wrong, not just when you're sick.
What are the Louisiana issues that we need to worry about? I know we talked about nationally, but are there any things that we need to focus on here in the state?
Elderly, disabled, and children.
Say it again.
Elderly, disabled, and children.
Okay.
Those are big costs.
We have a charity hospital. We're a little different in this state. We have a charity hospital system, but from what I understand, the charity hospital system is broken. The facilities are ancient. Big Charity in New Orleans, I hope they're going to level it and start over. They're talking about building the trauma center here in Baton Rouge that would replace those things. They've traditionally been teaching hospitals for the medical schools. I think that's wonderful. I think people get excellent care, but I think the facilities have to be good. And I don't believe anyone needs to go there to the emergency room and wait 12, 15 hours to be served. I hear about that all the time. I think that's criminal. The people at the hospital are not to blame. The facilities are outdated. They're not big enough. They don't have enough personnel. Now, if we're going to have this system, which is supposed to protect those people who can't protect themselves, then it should be efficiently run. It should offer them the care that they need, and they should get the best care available. They should not be treated like second-rate citizens simply because they cannot afford medical care or medical insurance.
Kevin, I agree that we that the state needs to focus, do a better job with elderly care, handicapped, and the children. And we spend an awful lot of money by forcing the elderly into nursing homes. And for example, my mother had Alzheimer's, and I was on a 24/7, and that can drive you nuts. But if I could have had a little part-time help so that I could back off sometime, she could stay at home. And instead of spending and that's a lot cheaper than putting those people in nursing homes. And we have a program, but it's so underfunded. And they have a waiting list. I think the last one I looked at in Baton Rouge was 11,000. And we need to do a better job in that area.
Yeah. I'm going to add on here, charity hospital thing. I do think they need to be torn down. I do think they need to be built. They need to be built to be really good hospitals. But I would also like in the major metro areas, I'd like to see a half dozen small clinics. You see the little commercial clinics around, that if you got the stuffy nose, you can go to the clinic instead of to the ER and keep the ER clear. And I do agree with that. My grandfather, I got to watch die for 7 years. Near the end of it, when the family was running out of money and the government was not covering his care, I was the one who moved out there and lived out there for a long time. So I understand that.
After our small group discussions, all of our participants got together in a larger session to question a panel of healthcare experts. Dr. Fred Cerise, head of the Louisiana Department of Health and Hospitals; Teri Fontenot, president of Women's Hospital; Senator J. Dardenne of Baton Rouge; and Roberta Madden, director of Women's Health and Public Policy for the YWCA of Greater Baton Rouge. Craig moderated the questioning.
Without much ado, I wanted to get into some of the questions that we had this morning. Ms. Baggett.
How do we get some kind of checks and balances throughout this whole system without going to socialized medicine? To say, okay, guys, we're tired of having to pay all of these. Mm-hmm. We don't want the doctors not to have money. We don't want to not have the technology and people going and doing the research. But we just can't keep affording this anymore.
Well, certainly the cost of health care is something that employers and governments alike are very, very concerned about. It's this year, for example, it's estimated that the average employer will pay about 9% more for health care coverage than the previous year, which is 3 times the rate of regular inflation. So absolutely there's a big concern about that. As far as how to do it, it's going to require a very comprehensive and a very coordinated solution, in my opinion, and one that's going to cause everyone that's involved in the healthcare system to have to agree to give up some things.
Well, I'm sorry.
Now, and for example, I think, you know, there are expectations by employers about the coverage. There are expectations by providers. There are expectations by patients that every facility have the latest and greatest, most state-of-the-art equipment and facilities and that sort of thing, and the highest quality, and that it not have to come from the employers or the employees or the patient's pocket. They want low deductibles, low co-insurances. And when you have all those things working at each other, there's not going to be enough money. So I think your question is, again, a very insightful one, and one that does not have necessarily a quick fix. Socialized medicine is something that gets suggested very often as one of the solutions. I don't think that's a solution, but it certainly would help in curbing the cost of healthcare increases. Although you have to wonder what it would do to the availability of high-quality healthcare. It's very available today to most citizens in our country. When you go to other countries and look at those areas that have socialized medicine, often they have to wait many months or a year, or they're not even eligible based on their age or other types of chronic conditions for procedures that we don't think twice about providing to patients.
There's clearly no easy answer, and I don't profess to be an expert in this area, but I will make this observation. The healthcare delivery system is the only product in America that I know of where you walk in the door and you have no idea what you're paying for. You know you know the deductible of the copay because you're going to give them that card and there's going to be a $20 copay or whatever it is. But then if you get a bill from Teri or you get a bill from a hospital, God knows what's in there and God knows what you're paying for and how they come about concluding what the charge is, and they will tell you that the charge on the bill has absolutely nothing to do with what they're going to get paid. That's ludicrous. I mean, we have created a system in America that is born out of uncertainty and confusion and keeps us all in a tizzy about what it's costing us, and we can't pin down what the cost is. And that's my biggest frustration about the whole system, and that's the biggest thing I would like to correct is let's know what the cost is. Let's reimburse for real cost, build in a profit margin, and deal with it on that basis instead of this huge quagmire that is healthcare, financing, and insurance in America.
Well, and just to add to that, we pay a lot for health care in the United States, and as you know, our outcomes are not the top in the world, and so there is a disconnect there as well in terms of the dollars that we pay and the outcomes that we receive. And so not only is it important to be able to know what we're buying, what we're paying for, but as consumers, typically you're not armed with the information to know if you're buying the appropriate thing even. And so to be able to have some indication of the quality of services that you're buying, are you buying the proper thing? And as long as there's this disconnect in terms of going in and getting services and not having the payment directly related to the service that you just bought, it's very difficult to know and to be an intelligent shopper to see, are you buying what you need? And so I think it's important that we develop quickly information systems and measurement systems that can determine the quality of services that are being provided, and then have some standards that hold our providers accountable to those things. And instead of just paying for whatever, as a payer, instead of just reimbursing for whenever you get a claim, having some connection to, is that claim an appropriate claim? Did you just buy something that is important to buy, or did you just pay a claim because somebody provided a service that may or may not be proven to be effective?
I'd just like to add a couple of things. I think we need to do a much better job in our society of educating consumers how to take care of their own health. That's one thing. You know, we need to know a lot more about nutrition than apparently many of us do, or if we know it, we're not doing what we should be doing. We need to be concerned about the epidemic of obesity, particularly among children, which is going to lead to all kinds of health problems in the future. And then the other thing is, and this is not long-term, but it's a short-term solution that's working very well right now, and that is a collaboration between the public and private sectors. I work for the YWCA, and we collaborate with the LSU Health Sciences Center, with Women's Hospital, with Mary Bird Perkins Cancer Center, and some other partners in order to make sure that low-income women, women who don't have health insurance, are able to get breast cancer screenings, mammograms, and breast exams, as well as Pap tests. And I think that kind of public-private collaboration may be the way we're going to have to go for the near future.
Mr. McConnell had a question for us.
Okay, our group come up with a two-part question. What efforts are being made, if any, for every individual to share in the cost of a national insurance system, which individuals or corporations or whatever, I think everyone should be involved in the cost, whatever they can afford, of course. And then the second one is how would we collect their share?
Dr. Cerise, I know you may be the best starting point.
I'll start with that one. You know, that is there are states that are looking at just that issue in terms of how do you solve this problem of the uninsured. And the approach that you're taking, I guess, most closely fits with what you'd call an individual mandate, having everyone pay into the system in some form or fashion. I think 15 years ago, when healthcare costs were 5% of the GDP, people were much more willing to subsidize your neighbor. Now that it's 15% of GDP and rising, there is much less ability or tolerance for doing that. And I think the point you make is a good point. We have a healthcare system in Louisiana and in the country that says if you present for care, you're going to get taken care of. You show up at a hospital, you will be taken care of. There is an infrastructure in place that is providing care for anyone who wants to access that care, yet it's optional whether or not you pay into that system. And I think there's a strong argument that can be made to say that according to your ability to pay, that people ought to be paying into whether it is an individual insurance mandate or some other method to have everyone paying into the system according to your ability. The Medicaid program that you talked about, that is an entitlement program. If you are at 200% of poverty, if your income for a family of four is about $39,000, you can receive full state federal benefits to deliver a baby. That is now, if you're $1 above that, you don't get that. It's all or nothing, and it's either free or you've got to provide for yourself. And what we know is that there's got to be more of a continuum there as you approach that 200% of poverty, an ability to expect that individual to participate in the provision of care. There's going to be people at the low end that society has got to take care of, but I think it is a reasonable expectation in my mind to have individuals participate more in the payment for those services than we expect today.
I'd like to suggest that everyone that has health insurance or pays their own for their own medical care does pay for it, and it's in the way of a hidden tax, because the governmental programs, Medicare and Medicaid and some other smaller governmental programs, pay less in many cases than the actual cost of care, and as a result there's cost shifting that goes on. And it gets shifted in the way of the charges that Jay described, where the charges maybe don't really mirror what the costs are for particular procedures or services, but it has to get covered in some fashion. So in that way, the private sector, to some extent, is paying the cost of care. It's just not a fixed amount, as Dr. Cerise suggested, but it's more in a way of if you access care, then you're paying for your care as well as somebody else's care.
Great. Now we have Joe Paul Steiner. And so Group 5 has a question for you.
Okay. It was our opinion that the working people, while they are working, would contribute a certain percentage, let's say 5% of what they paid in income taxes while they were working, to go to a fund which would take care of their personal health problems after they retired. This would get everybody, regardless of the amount of money they made, an opportunity to contribute to their own plan, which at the end of their retirement period, when they retired, would take care of them. They would be issued a card, and they would be taken care of whatever their health needs were concerned. That would mean that all of us, during our contributory time when we were working, would be contributing to our own retirement health fund. I see no problems existing there except as to who would take care of this fund, which we would not want involved with the government.
Well, the situation, and you've said the magic words with which I agree, and the situation you've described, if you just listen to it, sounds an awful lot like Social Security, where you've paid something in, or Medicare, and you're going to get something on the end. Now, if you're more akin to what we would call a health care savings program, where it's an individual investment that you direct, and you decide what you put in, and you decide what you do with it, now we're talking a lot more something that would get my attention, because that's something that we have encouraged at state levels. We haven't gotten to the point that we should be with that, but I think my sense is that's the future of where healthcare is going, is self-directed plans for savings during your working life, knowing that that's going to be what you're going to have to rely upon. But the problem becomes if you meld all that into one system and then your account's going to be responsible for somebody else, you're going to have some problems. If it's individually driven, that's what there's a lot of think tank discussion on that, and I think that's got some merit.
Well, now, Jay, would that work only when you retire, or would that be available to you during your working years?
I think what Joe's describing, it was only be when you retire.
That's your personal retirement health care fund.
But you obviously, again, you're talking about matching up systems, because if you're going to be under one system for your entire work life and then suddenly at the point you retire you're shifting to something else, you've got to make certain that there's not going to be a lapse in coverage. You're going to have pre-existing condition issues that are going to come up. I mean, obviously there are all kind of issues that would have to be discussed and considered, but something that empowers people to make individual decisions and direct it on their own, I think that's the way of the future, and that's the way we ought to be headed.
I think that's an excellent idea. The more people take responsibility for their personal health care needs, the better, be it from being more responsible for leading healthy lifestyles to making sure that funds are available when they do need medical care. It sounds like an IRA type arrangement specific for your health care needs, and I'm assuming you're suggesting there be some tax deductibility as it is paid in and then maybe taxed at a different rate or some way in a different way once you retire. It sounds very feasible to me.
And I just comment, I think it does sound like a reasonable idea. I think the population that you're going to hit with that is generally the population that already has health care. If you look at, in general terms, if you look at the population in Louisiana, where you have about 44% of the population at 200% of poverty or below, and many of the uninsured in the state are people who work but cannot afford health insurance. I think if you look at by worker group, a cook, for instance, would have to spend about 50% of his income for the typical health insurance package. And so these plans, while they are good for a segment of the population, I think it's not the full solution for the remainder of the population.
I would like to answer that in this respect. I think the poorer people would be more than happy to contribute a small percentage of their income, knowing they would be taken care of in the future and establish some form of self-sustaining.
I don't dispute that, and I think you're right. I think that they would as well. My only point is, if you look at the amount that a person who's working, a typical person working in this state would be able to contribute to that fund. Again, looking at the demographics of the state, while they could contribute some to that fund, it's not going to be the full answer for that person. And I think the issues we were talking about earlier, where we're actually looking at the healthcare system and seeing what you're buying, and we've got work to do on that end as well, because the costs in the system are just exploding. And if we just keep looking at the end of the side of how do we continue to feed that system, we're not ever going to have enough. We've got to work on the system side as well.
And I think Group 6 has a question that will dovetail nicely into the next question. Did that answer your question, though, Mr. Stein? Perfect. For Group 6, we have Mr. Penn.
Thank you. When we walked out of this building today, out of the studio, if there was a single change that you would make in the healthcare system, What would you as a panelist do to improve the effectiveness, efficiency, and availability for the healthcare system in the state, locally or nationally, without substantial increasing the cost in already an overburdened tax system? Thank you.
I'll start. If I could wave a magic wand, what I would want would be an electronic health record. If this information was available electronically so that all caregivers would have access to it, I think it would greatly improve the effectiveness and certainly improve the efficiency of health care. There's a lot of duplicate tests and procedures that are given. There's just a lot of bureaucracy and additional administrative burden with caregivers trying to share information between each and among each other as they care for an individual. So that is something at the federal level that is being pushed pretty hard. There is a plan within the next 8 or 10 years to have an electronic health record, and at the federal level there is some funding available. It's not enough, and all the local individual providers are looking for ways to try to find the ability to do that too. And that it's wrought with a number of problems such as privacy and that sort of thing. So it's not an easy fix, but if there was one thing that I think could be very effective in doing something about the quality and the efficiency, I think that would be at the top of the list for me.
Dr. Cerise, is there anything we can do to reduce costs?
I would agree with Teri and say to go one step further, and with that electronic record, have the ability to report on cost and quality of care delivered. And quality it's a hard thing to get at in healthcare. It's a hard thing to pin down, and you have to be careful when you start looking at trying to quantify that and publicly report that. But there are some parameters that are nationally accepted that people can all agree to, and I think if you can, when you can start to capture cost and quality, then you've got some information that can be useful in terms of how patients utilize the system and how payers preferentially use in the system.
Your caveat at the end makes it difficult without changing how it's paid for, obviously, because that's the big boogaboo that we all have to face is cost. But I would say to you, and I think we have the incredible opportunity to do this in the wake of the tragedy that this state is having to deal with. I would attempt to shift the entire delivery of health care to preventive clinics that would be designed to get people in the door early for evaluation and diagnosis before they get to the point that they've got to go to one of these hospital facilities where we pour so much money, and they do an incredible job. And Fred is a product of the charity hospital system as well, and I hope at some point he's going to be back providing medical care too, because he's a great caregiver as well as administrator. But the charity hospital system in this state has to be rethought. It is a model of the last century, and it has done remarkable things with limited resources dealing with acute problems. But as a state, we have to be better than that system. And we have to rethink a way to provide quality care to people who cannot afford it, but not necessarily drive it through a system that is unique among the 49 states as being a state-funded system. And that's going to be extremely difficult to do politically. It's going to be extremely difficult to do practically, but we ought not be afraid of that. I mean, this is a chance to rethink that paradigm. And if we don't do it, shame on us.
Well, I think the electronic record idea is very important. I understand that big charity, that some of those records were on paper and that they were lost during the hurricane, and that there is no record for some of those patients. I'm not sure whether that's true, but that's what I heard. The other thing is, I go back to what I said earlier, that we have to do a better job of the public-private partnerships, because it's obvious from the mood in this country today that we're not going to have universal health care anytime soon. And yet, we need the private hospitals, we need the Women's Hospital, we need all the other hospitals, we need the Mary Bird Perkins Cancer Center, and we need the organizations like the YWCA working with the charity hospital system in order to get preventive health care to people. And for example, the early detection program for breast cancer, which is what I work on. And we can do that same kind of partnership with many other health issues. It doesn't just have to be breast cancer.
Did that answer your question?
Thank you very much.
Well, that was Deliberation Day 2005. Just like Public Square, the day produced a fascinating collection of strong and at times passionate views on how to deal with America's healthcare system.
In the same way we polled our participants about their attitudes before the event, we polled them again once they had engaged in their deliberation and questioned the experts.
Well, one of the big surprises this year was the lack of significant shifts in attitudes among the participants. After the event, there were slightly fewer participants who felt their representatives in Washington had different priorities than they did. Slightly fewer also felt their state representatives held different priorities. When asked about the effectiveness of various schemes to control health care costs, pre- and post-survey responses were very similar. Participants were asked to rate the effectiveness or ineffectiveness of different approaches to controlling healthcare costs. Before the event, most, 60%, felt that increasing government control would be somewhat or very effective. After the event, this was still the method of choice for most of the audience. 55% still felt that way. When asked what should be the first priority of government to improve the healthcare system, there was a tie. Before the event, 69% agreed strongly or somewhat that the first priority should be to help the worst off. 70% said it should be to let people make their own choices. After the event, those percentages changed to 75 for both approaches. The largest shift came when participants were asked if they would be willing to pay more for health care if that meant many more Americans would have insurance coverage. Before the event, just over half of the audience answered yes. After the event, 2/3 said they would be willing to pay more in order to help their fellow citizens.
That's Louisiana Public Square for this month. We invite you to take our full online survey about the healthcare system by going to lpb.org.
Well, in December, we tackle a persistent and pervasive issue:
race and poverty in Louisiana.
Well, thanks for watching tonight. We'll see you again next month.
A home video of this program is available from LPB. For more information, call 1-800-973-7246 or write to the address on your screen.
This program was made possible by the William and Flora Hewlett Foundation, with additional support from the Rockefeller Brothers Fund, the Corporation for Public Broadcasting, and by contributions to your PBS station from viewers like you. Thank you. This is PBS.